Welcome to this presentation on healthcare bandwidth management. The business challenges around bandwidth are numerous in the healthcare sector. The first one, which is a universal one, is internet uptime. But specifically for healthcare, no connectivity means difficult moments in the office where there's tremendous amounts of costs and lost productivity which can get attached to. Uh, Key activities related to healthcare will include healthcare patient record management, will include insurance claims management and dealing with other forms of suppliers, and of course an emerging new way of conducting medical practice, which is remote medical procedures. Organizations should expect about 1.7 outages per month for about 67 minutes. Slow and saturated internet access links are now becoming common in every single business sector because of the media-rich content found virtually on every single website these days on the internet. Organizations have signed for ISP agreements in the last 2, 3, 4 years, and since then the dynamics have changed dramatically. Hence, the carrier links that are in place in many locations are no longer able to deliver the load required by the users and, of course, the content being accessed. HIPAA is a very serious consideration from a bandwidth perspective because Security Rule 164308A7I for contingency planning says that the organization needs to plan for disaster recovery and emergency planning, and connectivity falls directly under this mindset where if there's no internet access, normal operations will no longer be possible. Outbreak management is another topic which we've seen a lot of interest at Elphick in the last few years, namely because of the H1N1 virus. If there's an outbreak, employees, knowledge workers specifically, will not be coming into work, will be working from laptops at home or other sites, and will be remote accessing information at the corporate headquarters. So IPsec or SSL VPN tunnels will be significantly taxed. Web-based applications like Outlook Web Access or other systems will also be taxed. So organizations need to plan ahead against this type of situation. Last but not least, the latest requirement from a bandwidth perspective are guest networks, where just like in a hotel, visitors won't have internet access when they're at a hospital, visitors or patients alike, and they consume a lot of bandwidth for entertainment or work reasons and just stay in touch with friends and family. In this context, they download a lot of content and they will consume a lot of bandwidth. How can we resolve the first set of problems which are related to downtime? It's actually pretty simple when you take a step back and look at the big picture. Risk is the best way to mitigate risk is through diversification and spreading the risk across multiple points of failures. So the best thing an organization can do is use multiple ISP carriers from multiple ISPs using multiple ISPs technologies connecting to multiple central offices to make sure that if one carrier link is no longer available, others are there to continue to operate normally. The second thing we can recommend in this situation is to look at point-to-point wireless access, where there's a number of growing carriers on the market that are looking to deliver wireless through microwave dish connectivity. They offer very interesting packages, and sometimes they're very competitive from a pricing perspective, and it can offer a viable failover link or a business continuity link. But in case that all carrier links are no longer available, 3G wireless or 4G wireless can be a very useful option to make sure that key services are still available for the right reasons for the right staff. Internet saturation can be resolved through the use of multiple ISPs, but instead of numbers to solve the problem, we want to use the right link for the right reason. So symmetrical links such as T1s, E1s, fibers, DS3s, and so on should be reserved for key corporate critical applications such as voice over IP, VPNs, email, EDI, transactional sites, web-based applications for customers and patients, and so on. Asymmetrical carrier links can be used. We're thinking about here DSLs, cable modems, SMB fiber grade links like the Verizon Fios links in the US, to offload the traditional web-based content and other media-rich content onto those links from the symmetrical links. So, in performing this kind of activity, organizations can free up existing bandwidth without taxing their budgets in a significant fashion, because these are low-cost links typically. And are available pretty much everywhere. So this is a great way of handling internet saturation, and it's being deployed pretty much everywhere where there's bandwidth these days around the world. Elfic's been in the business of delivering bandwidth management solutions since 2004, and we have an interesting footprint around the world in any business vertical out there, let it be hospitality, healthcare, retail, entertainment, airports, education, research, whatever it may be. The bandwidth requirements remain the same core idea, and they need to be addressed. How can Elfic help you move to the next level from a bandwidth perspective? We have three scenarios for this presentation. The first one is if you have a single site, and this is exactly on the screen what is commonly deployed at most organizations. We have the users protected by a perimeter device connecting to one ISP to the internet. What we want to introduce here is a different equation, where we want to introduce a product called a link balancer, and link balancers will let you add multiple ISPs onto existing networks without complications, overhead, or complexities related to the traditional methods such as BGP. So you have a product that's going to be able to perform load balancing across multiple carriers against policies with additional ISPs. Again, this is a simple project, and it's very, very efficient. First benefit we get here is improved download and upload capacity, just because we have more bandwidth available. But in case one ISP stops operating normally, while the link balancer will automatically fail over traffic onto the alternative links that are there in place to continue operating normally. Well, as bandwidth is available, but when the link is coming back to its normal state, then it will be reintegrated and reinstated into the link pool that can be used by the balancer. Last but not least, guest networks can also be attached to those link balancer devices, and that way we can actually apply policies and controls to make sure that the guests have bandwidth to perform whatever task they want to do, but the core corporate bandwidth is protected at the same time. Scenario 2 is for point-to-point applications, namely the most common scenario for this is for VPNs, site-to-site VPNs. Two link balancers in place can be set to multiplex a VPN. So the first benefit is you have a lot more bandwidth available for the VPN application, therefore it's going to go faster. But the secondary benefit is very interesting. If this happens, or even better, if this happens, the session being transacted between both endpoints will not be reset. The link balancer turned from session-based balancing to packet-based balancing, and they just realign traffic against whoever's available to send and receive traffic from a carrier perspective. And that way, your VPN sessions are not reset. This can be for VoIP or any other point-to-point application. The third scenario we can look at in the case of healthcare is for business continuity, and this is disaster recovery planning, goes against the HIPAA regulation. If my main data center is no longer available and I've got users, suppliers, employees trying to come in, we can actually make them go through a secondary site and access resources that way. For employees within the organization that need to access the internet and we have a private WAN link available, we can actually make them go on the private WAN link, re-access the internet from a secondary site. This proves to be very interesting and resolves the pains around BCDRP, and is deployed around the world right now in many business verticals, including legal and healthcare, education, and banking. Managing bandwidth cost is quite often a very interesting topic to have a discussion on when we're looking at those projects. So we're going to have two scenarios, one for the SMB space, more of a smaller organization, and we'll have a larger one just after. This is a before and after mindset. If before we have a double modded T1 with the going US rate of about $800 a month for metro access, you get 3 megabits symmetrical of traffic. If we throw in a link balancer and aggregate a cable modem, a fiber connection, and to alleviate costs, we downgrade the double modded T to a single modded T, we actually are in the same price range from a bandwidth perspective. So there's no incremental monthly cost per se from a bandwidth perspective doing this project. If you look at the bandwidth gains, we multiply by 34 times the available bandwidth for the site, and we multiply by 8 times for the upload side of the equation. So we bring tremendous amount of capacity and value to an organization or a branch office, and in the same token we bring 3 carriers using 3 different technologies, using 3 different COs for maximum redundancy and resiliency. Now, in the case of a larger organization, if we have a site, as an example, running a DS2, which is a 45 megabit symmetrical link, the average rate for that in the US, in the metro area, is $3,500 a month. If we keep that DS3, we throw in a 10 megabit fiber to have a failover for critical apps and services, and at the same time, we add a cable modem and fiber connection to actually bring just more capacity to the network. The bandwidth costs are not going vertical from an incremental cost perspective. We're looking at $1,400 more a month of bandwidth to multiply by 3.5 times on download and 1.7 times on upload, which is a significant amount of value. And we bring 4 carrier links connecting to 4 different carriers, connecting to 4 COs, same idea, and that way you have maximum uptime and redundancy for that specific site. So these are 2 simple scenarios that are commonplace amongst our customer base. What are the next steps you can take to improve the network? First one is, please feel free to give us a call. Our consulting team will be available to look at your projects and see what we can do to help you out. Second suggestion is, please send us an email at healthcare@elfiq.com. Our consultants will be able to look at your projects and your questions, then we can take it from there. One thing that we also offer is, please send us your network diagrams in VIZIO, JPEG, PDF, or any other common format. That way this will strengthen the discussion and we can have answers delivered more quickly to you and your organization. Elfiq.com/healthcare has a lot of information and answers and documents that you can download. You can try an Elfiq Balancer just to get a feel of the reporting capabilities and see how it operates. Also, we have webinars available online, pre-recorded, available 24/7. And if you wish to calculate your return on investment from a bandwidth management perspective, you can do so at elfiq.com/ROI. Thank you very much for attending this online webinar on healthcare bandwidth management. And if you have any questions, feel free to reach us at any time.